Dr. James, let me first just get your thoughts on this data we got out from Novavax today. 90% efficacy would certainly put it on par with Pfizer and Moderna's vaccine. How significant a development is this, especially for the global picture in this fight against COVID?
This is just such a huge and welcome development. This is very effective. And you heard from the CEO, his plan to start with low and middle income countries is just completely profound. So I'm just thrilled to hear these numbers, but I'm even more thrilled about the plan for distribution. America is in a place where we have vaccines to spare. And so, to see our neighbors around the globe getting this help is huge.
Yeah, we're going to be chatting with him about that rollout in just the next hour. But when we think about what it means, even in nations that have had success rolling out their vaccines, I'm thinking about the UK and what we're seeing there, potentially postponing their full reopening plans. I think it would give people pause here to wonder, could a spike happen yet again, given where we're at? I mean, as you watch that, what do you make of maybe how there are still risks out there, even though we may have passed some pretty important thresholds when it comes to vaccinations?
Yeah, that's a great question. And I think the thing I like to kind of get people to think about is who is really protected right now. Again, we're still dealing with profound disparities in vaccine, access and who is vaccinated. And essentially, we know that if you're unvaccinated, you're still, of course, at risk. So even though, large swaths of America are protected, there are still lots of folks still vulnerable. But I think that the difference is that I look at is it's really not a question of supply anymore. It's a question of getting that supply to the right folks in America, but also internationally. So my hope is that we still don't need to sort of relax these efforts to make sure everybody in America is safe. Having the supply is really just the first step.
Yeah, I mean, having said that, we did get that commitment from the G7 leaders over the weekend, 1 billion additional vaccines for developing countries. But that's still well below the number that WHO has put forward, saying this is the amount of vaccines we need in order to get everybody in the world inoculated. How big of a dent is that likely to make? And really, how significant is the announcement when you think about all of the roadblocks that have existed to actually getting the vaccines distributed?
Man, I mean, the announcement is good, but again, look, we're over a year, into this, and so it would have been nice to have this commitment sooner. And sort of when you're in this panic mode that America has been in for so long, and I think the world has been in, ethics we find tend to get pushed to the back. But again, I think there's just increasing focus that people realize we are global citizens, and that as we're having conversations about America, we have to have conversations about our neighbors. And I hope that people look at the variants, really reinforcing this. We see this as sort of international effort to embrace this. In my personal opinion, I would have hoped that it had come along sooner, but I am happy that it's here now.
And back here in the U.S., we're kind of at the point, as you're kind of describing, important to get that last I guess it's kind of half, a little bit less than half here of the country that still needs to get vaccinated, whether they like it or not. We're starting to see some new mandates coming in here on the part of employers. And we saw that a judge dismissing the Houston case there as hospital workers didn't necessarily want to get vaccinated. Talk to me about the pressure that you're seeing there, maybe not just in the medical community, but also as employers bring people back into the office, what you're making of what we're seeing now when it comes to making sure people are doing so in a safe manner.
Yes. Quite frankly, I think my employers have a bit of a quandary because we saw at the beginning of the pandemic, there wasn't, in the example of healthcare system, there wasn't enough personal protective equipment. So they're sort of behind the boat of the ethics to say, yeah, now we want to keep everyone safe. They're just going to have a hard time getting support, is my opinion, from, their employees. I think, you're seeing, this tension between personal autonomy and the safety of the community. For people like us in healthcare, we are in charge of so many lives, so many vulnerable patients, elderly, people who have immune conditions, medical conditions, that it is a different conversation, I think. However, I think all employers are going to face this tension, and you can either go, mandate, but I think everyone would agree it's better to get people's buy-in. It's better to do, think about protection in a broad way where that includes safe working environments, and to really get that buy-in. But I think to your point, you're right. I think employers are going to have to take a stance one way or the other.